Hello everyone, today what we are going to talk about hair removal laser. Botox injection and hair removal laser are the two most common procedures carried out in the field of non-invasive cosmetic intervention. Hair removal laser is recognized as a state-of-the-art treatment resulting in permanent reduction in hair densities. During the past years, since 1960, a consistent eager was for finding a method with permanent result in reducing hairs. However, in 1980s, the theory of selective photothermolysis was introduced by Anderson and Parrish. Finally, in 1996, the first successful use of ruby laser for long-term hair reduction was reported. Contemporary demand for hair removal laser is not confined to hirsutism or hypertrichosis. Today, really anybody, including women, men, young girl, young boy, anybody what's with any hair growth, just wants to stop shaving all time or tired of getting waxed, comes to cosmetic and dermatology office. Many of them complain from inflammatory responses such as pigmentation or erythema following repetitive shaving or waxing. When an individual comes to the dermatology office, they first take a thorough history and perform physical examination. Patients with evidence of endocrine abnormalities, dysfunctional menstruation, or those with rapid onset of excess in hairs should be approached at first medically. However, the majority of individuals that are normal medically are evaluated by looking at their skin. The best results are with those their skin is light and their hairs are darker and thicker. The patients are advised to shave the treatment area 1 to 3 days before the procedure. The reason behind this recommendation is that the presence of long hair shaft leads to damage to upper layers of skin, epidermis. But by shaving, we have a fine stubble that ensures the presence of target for action of the laser. Whether topical anesthesia is necessary or not prior to procedure is not clear. Some people can tolerate this procedure and report it as little burning sensation. The others cannot undergo the hair removal laser without use of anesthesia. However, in those with request for anesthesia, a topical form such as cream or gel could be applied 3 minutes to 1 hour before treatment under occlusion. Although hair removal lasers today are with skin cooling and it primarily used for reducing the risk of epidermal damage and burn, cooling of the skin surface could also minimize the pain. Let's explain the continuation of the procedure on a patient practically. We are using a Candela Gentle Max Pro laser, which is one of the top-of-the-line lasers suitable for all skin types and has 2 modes of laser, Alexandrite and Nd:YAG. By these 2 facilities, we can safely treat all skin types without pigmentation problem. Note that Candela is the name of the company brand, and Alexandrite and Nd:YAG refers to the basics of lasers physics, the wavelengths. Many companies today produce lasers having Alexandrite or Nd:YAG or both of them, but Candela is one of the best known top-of-the-line laser. Today we are using the Alexandrite mode, which is suitable for treating light skin with dark hair. We have our laser therapist here. The legs of the patient has been gridded off by the laser therapist into sections that she can keep more control on the treatment area. As you see, the laser acts in a rapid mode. An area like lower legs will typically take around about 20 minutes. The patient reports feeling of laser procedure as a warm sensation, yet a slight pinch, but she doesn't have any pain sensation now. It's okay. It wears off very rapidly. Now let's look at here. A few seconds after procedure, the treated area will become erythematous and will have perifollicular edema. The patients who underwent this procedure, it's important to stay out of the sun and not to tan the area for reducing the risk of pigmentation. It should be added the patients to wear a broad spectrum sunblock. Many recommend sunscreens of high SPF, but it's not true. A sunblock of SPF 30 with coverage against both UVA and UVB, not only UVB, is more suitable rather than deciding on increasing the number of SPF. In general, we do about 6 to 8 treatments, separated by about 4 weeks in the case of face and 8 weeks in other parts of the body. When appropriate treatment parameters are used, we expect about 10 to 20% long-term hair reduction with each treatment, but the amount of hair reduction may be not the same with each treatment. At the end of treatments, we have found after 6 to 8 treatments, we've reduced the hair density by about 70 to 95%. Although hair removal laser is not covered by insurance, the cost usually depends on area treatment of the body and also how many treatments you're going to need based on your physician's suggestion. For any else question, talk with your board-certified dermatologist. How does hair removal laser work? The player in laser hair removal is light, monochromatic coherent light. It acts against the hair. Like seasonal changes during a year, hair follows a unique growth cycle that involves growing compatible with spring and summer seasons, shedding compatible with autumn, and resting compatible with winter. Light of a laser is a type of wavelength. This wavelength affects the pigment of hairs in the growing phase of hair growth cycle. It's why hair removal laser is not effective against the white hairs, and all hairs are not affected as the same by the laser. Some hairs are in the growing phase, while the others are in the shedding and resting phase. When intense beam delivered from laser, it absorbed by hair follicles. Here the light converts to heat that damages the hair follicles, specifically the bulb and bulge regions of hair follicles, that prevents further hair growth. So the absorption of light by hair is dependent on both the hair's amount of pigment and presence of suitable hair phase in the hair growth cycle. What are different types of hair removal laser? The four main types of laser for hair removaling are ruby, alexandrite, diode, and Nd:YAG. With increase in the wavelength penetrates deep into the skin, while the upper skin as epidermis remains undamaged. What is the most suitable laser for individuals with darker skin? Nd:YAG laser is the most suitable laser for darker skin as Fitzpatrick skin phenotype 4-6. The reason behind this goes back to the wavelengths of this laser in comparison with other hair removal lasers, that is 1064 nanometer. The Nd:YAG emits the deepest penetrating wavelengths among hair removal lasers that bypasses epidermal pigment absorption. Compared to other hair removal laser that the light's been produced in the middle of melanin absorption, the Nd:YAG's light is absorbed in the tail of melanin absorption. Melanin is the pigment molecule in the hair and epidermis. A common question is about the difference between laser and IPL and which one is better. For better understanding the subject, you can consider a group of soldiers. Some are tall, the others are short. Some are thin, the others are fat. And now consider another group of soldiers, the second group of soldiers who are the same and all are fit size. Obviously, the second group who are the same and fit size can act better. In the case of IPL and laser, IPL is like the first group of soldiers as a broadband pulse light source, whereas laser is a monochromatic coherent light source like the second group of soldiers. As a result, lasers are generally more specific and effective. IPLs in general are considered old technologies in comparison with lasers. However, in the case of both light skin and light hair, IPL could be considered as a good choice. Is there any difference in performing hair removal laser between dermatologists and beauty salons? While generally hair removal laser is safe, side effects are possible and only a trained medical professional knows well about doing the right method of this procedure. For achieving the best results, performing a thorough history and physical examination is important. And obviously this aspect of work will not be performed in beauty salons. Why touch-up sessions are necessary following hair removal laser? When the hair follicle is destroyed fully, it will not regrow. But sometimes the hair follicle is only damaged, but not destroyed during the laser hair removal procedure. So in these cases, the touch-up sessions are necessary. Experts now consider hair removal laser as long-term hair reduction rather than permanent hair removal. For how long prefollicular erythema and edema following hair removal laser can persist? Prefollicular erythema and edema following hair removal laser generally persist for 2 days but can last for up to 1 week. Some patients note that all their hairs are fallen after the first treatment of laser, but in the others the hairs leave behind. Why? When the used wavelength is a short pulse duration type, patients will find a total epilation of the hairs and even say that the laser was totally effective only with 1 session. But it's not related to successfulness of the laser, and the majority of hairs will regrow, so they should not consider this hair regrowth as the treatment failure. Contrary to that, when a long pulse duration is used, most of the hairs leave behind and will shed about 1 to 2 weeks later. This not also means a treatment failure. In other words, shedding of hairs immediately following the procedure is not the benchmark for treatment response. How long should be waited following waxing or threading if somebody wants to do hair removal laser? Although there is not an evidence-based information on this, most experts recommend at least 6 weeks. Some patients are reporting of converting of fine hairs to more prominent ones following hair removal laser. Is it true? In the textbook of dermatology and lasers, we have a term as paradoxical hypertrichosis. According to this term, we normally expect a reduction in hair density following the laser, but in this situation, the hairs will be increased conversely. In other words, fine vellus hairs convert to thick terminal hairs. Although this event is rare, the absorbed heat of the laser light is not adequate to destroy the hair, and this insufficient heat for destruction acts as an inducer of fine hairs. This event is very common when the laser performed on the fine hairs of the face of Asian women. Is hair removal laser suggested or should be avoided during pregnancy? Hair removal laser refers to the cosmetic field that considered non-urgent procedure. So, treatment of a pregnant woman for such non-urgent condition is not necessary. This decision by experts is not related to whether hair removal laser is teratogenic. It refers to the non-urgent nature of hair removal laser that could be done later. Is hair removal laser suggested or should be avoided during breastfeeding? According to evidences, hair removal laser doesn't seem to affect breastfeeding or breastfed baby. So, it's not contraindicated during breastfeeding if the laser is done in supervision of a dermatologist. Which dermatologic disorders should be considered before performing hair removal laser? Any dermatologic disease with Koebner phenomenon should be evaluated by the dermatologist before laser because it could affect the body response to laser. Koebner phenomenon is a condition in which any trauma to the healthy skin could induce the dermatologic lesion that the patient does have in affected areas. And here, the laser light acts like the trauma. The most known instances of Koebner phenomenon are psoriasis and vitiligo. So before performing the laser, giving complete information to the dermatologist is necessary. Likewise, anybody who has history of urticaria should give accurate history of the disease to the physician. Although Koebner phenomenon does not exist in urticaria, but we may have here dermographism that could be evolved by the laser light. Now we are talking about some common misconceptions on hair removal laser. A lot of people think this is a permanent elimination of all hairs in the treatment area. According to the US FDA, United States Food and Drug Administration, hair removal laser leads to a significant reduction of hairs in the treatment area, but it doesn't mean neither the elimination of all hairs nor as a permanent effect. All individuals who underwent hair removal laser should understand that periodic touch-up procedures are necessary. Many others think it can work for gray or blonde hair, but it's not true because the target for light wavelengths here is not available. This target is melanin molecule. So, in blonde hairs, actually no target is present that absorbs energy from the laser. However, with advent of new technologies within future years, we expect a solution for this group of patients. A common question asking from board-certified dermatologists is whether hair removal laser could be done for dark-skinned individuals. Many think it cannot work, but the answer depends on the type of laser. Today we have some specific lasers that work well for dark skin. And many others are concerned about the potential risk of induction of cancer following hair removal laser of some parts of the body, especially underarm. It's obviously a misconception. You know that it's more than 20 years since 1996 when the hair removal laser came in the field of cosmetic procedures. Actually, no evidence-based report confirms a link between this laser and occurrence of cancer. And some other candidates of laser are asking about the risk of hair removal laser on infertility, especially in the case of bikini. It's also another misconception. There is not any proven link between occurrence of infertility and hair removal lasers since the first successful use of laser in 1996 up to now. Based on both historical reports and biological aspects of laser, there is no risk related to hair removal laser and infertility. And the others are concerned about the use of systemic isotretinoin during hair removal laser sessions. They ask, is it safe to use systemic isotretinoin during hair removal laser? In contrast to previous informations, recent papers since 2017 say that systemic isotretinoin known as Accutane is not contraindicated in the treatment sessions of hair removal laser when it's used in the supervision of a trained dermatologist. I hope you've enjoyed this video. In the next video, I'll talk about other subjects in the dermatology and cosmetics.